we'll get started. For those of you that don't know who I am, my name is Carrie Mitrione, and I'm a registered nurse based out of Gainesville, Florida. Today, I am so honored to have a special guest here with me, and his name is Dr. Ilyes Baghli. He is based in Tlemcen, Algeria. I hope I said that right.
Yes.
He is the co-author of the groundbreaking protocol. It's a cancer protocol hybrid, and we will be getting into that today. And he is also the president of the International Society of Orthomolecular Medicine, and we'll be getting into a little bit about what orthomolecular medicine is as well. So thank you so much for being here, Dr. Baghli.
Thank you very much. And also, we are very happy to share this hybrid orthomolecular protocol for cancer. You know that, example, Dr. William Mackey shared a lot of about cases who are healthy now. Also, you know, media share about Mel Gibson, who share about his friends that they are safe. And we are now about to make a new paper. We just have an exchange today about to share a paper about cases with good healthy, so with this protocol, because you know this protocol we use it before, but what we keep new that we share between different protocol in one protocol, and we give the name of hybrid orthomolecular protocol for cancer. So in 1 week, we will publish a new paper. So you have the breaking news about it.
Oh, that's
So
great.
Yes, because I just received that all is okay to make a new paper between me, Dr. William Mackey, and Pierre Martinez about cases in USA and, sorry, I will say North America. I don't know it's Canadian or USA, but in North America. And in other weeks or 2 weeks, we will make another paper about cases with very amazing results in Manila, in Philippines. So you see North America and southeast of Asia. So the protocol will make better with new papers. We don't, we make it step by step. We didn't go on with all in this paper. First of all, we do first of all in April a paper about targeting mitochondrial stem cell and cancer with Dr. Thomas Seyfried from USA, and also Pierre Martinez and me. We make the publication on MDPE journal. And next, in September 19, we do the publication about the hybrid protocol, orthomolecular protocol for cancer. And the name of this protocol is Baghli I and all 2024. So I choose the responsibility to give my name to this protocol because in this protocol, we are making the best for all patients, all person with disease, all person with cancer, because a patient need a vitamin C to make cancer cells in autolysis, in apoptosis by hydrogen peroxide, who come from vitamin C at pro-oxidant doses. And also in based reference, we share about NADH, so it's NAD plus, and the importance to share it with vitamin C. And this we do the publication on David Publisher in USA in 2016. And we share in this protocol about vitamin D. vitamin D about 50,000 unity a day for cancer in low or middle or high level of type of cancer. So for low grade and middle grade and high grade, the minimum is 15,000 unity a day. And next, we will do around what is the level of vitamin D in the blood. And for vitamin C, of course, we use doses like 1 gram to 1.5 grams a kilogram a day. So we can have like around 100 grams a day by intravenous 2 times or 3 times a week or every day. But we share also the study of Dr. Hickey, who shared in 2020 that if we use in long time vitamin C intravenous, vitamin C liposomal, and vitamin C powder oral give the same result when we use it for 6 to 12 weeks. And also, we share that vitamin E is an anti-inflammatory. Vitamin C need vitamin E to make low inflammatory in the body. And you know, for each one who had a cancer, there is a problem of inflammatory.
Right.
So, and vitamin E is a cofactor of vitamin C. Vitamin C is a cofactor of vitamin E. And also, you have to know, and all doctors have to know, that vitamin E need cofactor Q10 to be more benefit, more effect. And also, we share about zinc. And each one who had the flu, COVID, and also cancer or other chronic disease need 1 milligram a kilogram a day of zinc. So by using this way, without forget that vitamin D need also magnesium and vitamin B1, B6. If you ask to make detoxification to the body, we need niacin. It's vitamin B3. And also we can add selenium. It's important with the zinc and with the magnesium. So it's a global protocol of orthomolecular therapy, but officially in the paper you will read only about vitamin C, vitamin D, and zinc. But in a reference you will find between different reference study about NADH and vitamin C and other like what I share about it. But another thing who is really important and really benefit, and it's a mistake to don't care about it, that each one who is with cancer can have parasitos. So he need a treatment for parasite. Of course, we have naturally some natural therapy like ginger, like artemisia, artemisinin, like gardelin. It was natural, but also we can share with postbiotic therapy by ivermectin.
Right.
Yes, also by mebendazole. We can use 200 milligram a day for low grade level of cancer, and 400 milligram a day for middle or high level gravity of cancer. And for that, we can use also fenbendazole or EON, but the most simple is to make between ivermectin and mebendazole or fenbendazole. We have a very nice result in USA, in Philippines, and we will share it weeks in a few weeks or few days, and this will promote more this protocol. And we have to not forget that ketogenic diet is
Mm-hmm.
important. You had to eat 6 eggs a day, and the yellow must be liquid. You have to need to eat all like Roquefort, like Camembert, like how say butter, but natural butter, not margarina. And you have to eat uh, like meat and other things like dry and salt meat, and also like dry and salt fish. This is important for the microbiome, because if the
Okay.
microbiome is healthy, the body will be healthy.
Okay.
And other thing is to promote an anti-inflammatory nutritional program without using, cereal, OGM cereal, or also without using corn cereal. So we have to don't eat bread, don't eat
Mm-hmm.
like pizza, like
Oh, come
sandwich.
on.
Yes, for maybe 6 weeks to 12 weeks, it's therapeutic. Yeah, you have
True.
to eat like Viking, only meat with good salt and with some vegetables. It's more healthy with spicy. Spicy is really interesting, and we have to make out also sugar. This is what is the most inflammatory product for the body. And also you have to don't use milk. I share about the milk as milk, but all cheese or all like butter or how say like dry milk. When we use it like we say Leben, it's when we keep milk giving lactoserum, and we drink with lactoserum. It's very healthy for the
Oh,
microbiota.
okay.
Yes, it's traditional. We share about the traditional using of milk without using
Right.
pasteurization. Pasteurization, yes. So raw milk is good, and pasteurized milk is not good. This is the reality that we have to take a look 100 years later to be more healthier.
Right.
And other thing is about sport, about
Mm-hmm.
walking 45 minutes a day to 75 minutes a day. If you don't do it, do only 5 minutes a day and start step by step, 10 minutes, 15 minutes, 20 minutes. And this is really interesting. And other things is about fasting. Fasting, a lot of people, Muslims, Jewish, Christian, do fasting, but sometimes what they eat next fasting is like 3 times or 2 times more than what he didn't eat when he is fasting. If you use fasting, you have to eat something fewer eating, because you are making the body in detoxification.
Okay.
So it's really interesting to don't eat a lot when you do fasting, to have the benefits of this fasting. And you know that there is a lot of study also in California, in USA, and I use it for publication on a newspaper in Algeria about fasting. Fasting is good at time of COVID, and I use this paper of I will remember. I think so. The study is about from 5 days of fasting the telomeres and are growing, and it make healthier the body. So this is study. I can share it with you next
Yes.
in Instagram, because I do this this paper in newspaper, and it is really interesting. And other thing, we need oxygen. The healthy cells need oxygen, and cancer cell don't like oxygen. For that, if you smell the good oxygen near the ocean, near the a beach, a river, it is really interesting near the sea.
Mm-hmm.
But the best timing in the day is to had how we say, like cardio respiration, where when you inspire 5 seconds, you block, and you expire 5 seconds. This is, you have to do it early in the morning,
Mm.
just before and at the time will in sunshine. This is the best time, because there is a oxygen ionized.
Okay.
So this oxygen, earlier in the morning, we have only in this time that we can find it. And also when you are near the sea, you can mix between iodine ionized from the sea, by working near the at near the sea or near the ocean, and with the oxygen ionized. So this is really a therapy, and a lot of people had the problem with health because they are not enough outside to do like jogging earlier in the morning.
Mm-hmm.
It's really important, because in the afternoon it's good, but it's not enough like earlier in the morning. So I say to all people who do earlier sport, walking or jogging or bicycle, it's really interesting. It's really healthy, and it's really important. So you look that with this protocol, it's just a logical
Yeah.
thinking. It's only a way to have something simple,
Right.
because something simple will make you more healthy than we can imagine.
So, for people that don't know what orthomolecular medicine is, could you maybe just give us a little background about what the fundamentals are?
Yes, of course. Ortho mean right, mean from the body, and orthomolecular therapy mean therapy by using what is inside the body. So if you use vitamin, it's orthomolecular medicine. If you use amino acid, it's orthomolecular medicine. Coenzyme, oligo elements. Also, if we use cortisol, because cortisol exists in the body. So oxygen, ozone, hydrotherapy, hydrogen therapy, all these are orthomolecular therapy. Also, eating, drinking, sleeping, fasting is also orthomolecular medicine, because it's the therapy where we don't use chemical product, but we use only natural product or natural way to still healthy.
So, I guess it would be fair to say that those are some of the things that are incorporated in the protocol that people can do to prevent disease in the first place. Because let's talk a little bit about prevention, right?
Wait.
So,
Yeah, yes, it's really important, because next COVID vaccine, a lot of people with oxygraphen, with RNM, with how the spike protein. There is a lot of case of inflammatory in the body, and also there is a pandemic of turbo cancer. So by using this protocol for healthy one, but in preventive doses, we make detoxification of the body. Example, by using vitamin C, vitamin D, zinc, also anti-parasitaire, it's important. But in the case of COVID vaccine, we need to add niacin, so vitamin B3, NADH, so it's NAD plus. It's the hydrogen form for giving ATP to the body to make normal cell more healthy and to destroy the cancer cell or all cell with inflammatory. And also we need to get a good level of vitamin D between 80 and 100 nanogram by milliliter, or 200 to 200 and 250 millimole by liter to be healthy. So you can see that the body need a lot of things to be healthy by giving what the body needs from vitamin, from oligo element, from coenzyme, and also from amino acid, but also to do the detoxification. Detoxification from spike protein, from graphene oxide, from heavy metal, from pesticide, from fungicide, from electromagnetic rays, from X-rays. You know, now we can say in the morning, not had a good day, but maybe good luck, because there is a lot of, there is pollution, there is a lot of things who make the body not healthy. So we have to be more intelligent by using example only by drinking like Chinese people, like Japanese people, drinking 3 cups of water in the morning, drinking 1 cup of water before sleeping, drinking 1 cup of water before eating, drinking also water at sauna or in before going to the shower or to Turkish bath. But this water must be a little bit hot to make you more, and I say nearly to the temperature of the body. For Celsius, it's 37, but I don't know in Fahrenheit how many we need
That's
the
right around
temperature of the body.
98.6.
Sorry?
I think so. 37 is right around 98.6 degrees Fahrenheit
So
ish.
let's do it like Kiri shared with you. So it's 37 for water before drinking. And also we have to take a look to the best water. Not any water can be healthy. You have to go to the from natural water, and it's really difficult to get it now because there is a lot of nanoparticle from plastic. Example, so the bottle with for water in plastic can give nanoparticle to the body, and it can make microbiome with the nanoparticle. You know that at time there is a lot of problem of fertility, and we find that one the most problem in uterine microbiota
Right.
or vaginal microbiota is that we find nanoparticle of plastic. Plastic. It's how say like this. It's not healthy. I didn't drink it. It's from my patients, but I keep
Oh.
it to share with all my patients. Do don't use it to get water in like a glass bottle or something like argile bottle. It's natural, or copper water,
Right.
copper bottle. It's really healthy, but not plastic. And there is a lot of also thing to do for detoxification to make best fertility. If someone, if there is, we will share today, like there is the same problem that's keep turbo cancer, and there is also the same problem give sterility, problem of fertility. There is a lot of parents who hope to had a baby, but there is a problem. So in the same cases, they have to use an anti-inflammatory program, uh, and also a cetogenic diet, fasting, drink water, doing sport, going outside early in the morning, walking to have a view when the sun shines, also to have the good respiration early in the morning, and also get the supplements that the body need, like vitamin C, zinc, vitamin D3, magnesium, complex B, and also NADH. But we need also the detoxification by vitamin C, magnesium, niacin, so B3. This is, and also N-acetylcysteine, NIC, is also important to make outside the body all things like aluminium, like mercury, like arsenic, like cadmium, and also pesticide, graphene oxide, and also protein spikes. So you can imagine that each one need to make himself healthier by supplement, by detoxification, and the most important, drinking what is really healthy. It's the more simple, is the water.
Yes. So there has been a pretty high percentage of people in my country, at least, that have taken the spike protein vaccine. Um, so do you have the things that you discuss, which there's so many valuable insights there. There's a lot of valuable information, and it's quite difficult to retain all of it when you're watching a live. Do you have that information written down somewhere so that I can share that on my
Yes,
page so people can
yes,
reference that for people that have taken the vaccine and that want to do everything that they can to keep themselves healthy?
yes.
And okay,
That's what I share. I will share again for
okay.
to be more simple. Vitamin C. The body need vitamin C for detoxification, because when you use vitamin C at the therapeutic doses, you will have like a little diarrhea,
Mhm.
okay? And this diarrhea make clean intestinal the body. And the second thing is the magnesium. You need magnesium. Also, you need niacin, vitamin B3. You need also N-acetylcysteine, NIC, you know. Also, we need vitamin D3.
Mhm.
You need magnesium. I say magnesium, but B complex, all B complex, and the zinc. So, do you have a look that the treatment of cancer is the same treatment for detoxification? Because in hybrid orthomolecular protocol, we go to the causes of the disease. We go from where come the problem, from the really problem for the body, how to be healthy. So
Mhm.
when you go to how to be healthy, the problem that make the disease in your body will go out. So prevent, it's not for who are healthy, but also who had a disease will be healthy when he use detoxification supplements, and it's really simple,
Yep.
it's really cheaper, it's really logical, but we have to know how to learn
Yes.
for this learn, and to know what we know before.
Well, and that's what we're here doing. We're educating everybody,
Yes,
and we get to do this. You are in Algeria, I'm in United States, and we get to do this together.
yes,
Isn't that amazing? We get to spread the word, and I'll continue to spread the word as much as I possibly can. And is there anything you'd like to add?
yes, of course. Um, I'm um, I'm now very happy that a lot of people around the world from COVID time, from 2020, now there are more people, how I say, conscientious citizens.
Yeah.
So because I am doctor in medicine, but I have to say that the responsibility to be healthy is to a citizen, a conscientious citizen, not to the healthy system, not to the doctors. Doctors can give you how to be healthy, maybe, or not. It depends what he learned and what he dislearned and what he learned after he dislearned what he learned before. And so now people are more asking about how to be healthy. They are asking about neuroscience, about meditation, about contemplation, about spirituality.
Hmm.
So I think we are at a moment in the history of humanity that we go now from better time, from conscientious times. And I will give something. When it happened in America, it happened the day next in the rest of the world. For that, from Algeria, I share my knowledge in America to make it more simple for all humanity and not only for America.
That's just amazing. We need more of you. We we
Thank
need
you.
we need to we do. I really, we could really use more of you over here in the United States, just the way that nurses and doctors have been trained. And it's just incredible the information and the knowledge that you give us. Things that I never learned with a 4-year degree in science. None of this stuff I was taught. So this information is great because I can pass this on to my patients that I serve and take care of. And I can incorporate that into my plan of care and,
Of
just
course.
on Instagram and talking to everybody. And it's just so nice to have you to collaborate with. I feel so blessed. And I just feel like this is the path that I'm going to take. People are, like you said, now more than ever, people are ready to hear these discussions. And so just keep doing it. And, just you have so many great insights, things that we can do to stay well. And this protocol is
Yes.
amazing.
If I can add something, I am the
Sure.
president of International Society of Orthomolecular Medicine. Um, I, I am president from 1st June 2023. I am introduced to be the new president in Sao Paulo in Brazil. And I share in my speech that all what I will do will be free. I do it for the humanity. I do it for how say the benefit will be maybe spiritual, because when all people pray for me from different religion, from different nationality, we received the gratitude, and the gratitude is, how I say, it's the spiritual intelligentsia that we received more than we can imagine in the best of our dream. So I am really, I agree to share more and more for all who ask about it. We can do it like this by interview, by